Hi, greetings from Toronto, Ontario, Canada. My name is Nelson Shen. I'm a project scientist at the Center for Addiction and Mental Health, or CAMH, here in Toronto. Um, I'm really excited to present this work to you. This was work that we embarked on early on this year to really inform the digital health strategy. And the purpose of this work is really to understand what the priorities are of those Canadians that are affected by mental health conditions. So let's begin. So we'll start with the conclusion. Canadians affected by mental health conditions prioritize digital health tools that help them, one, navigate the digital and physical mental health spaces, and two, are integrated as part of their care. So I'm presenting on a study which we might call the Planning for the Future of Digital Mental Health in Canada, priorities of Canadians affected by mental health conditions. Before I begin, I'd just like to recognize fabulous team that have been working on this. Have made tremendous contributions to getting this to where it is now. This team includes Iman Kassam, Navi Poparai, Dr. Clement Ma, Dr. Shang Chen, Dr. Damien Yankowitz, and Dr. Jillian Strudwick. So the background for this work. Um, as we all know, COVID-19 has had its impact global impact on mental health in terms of, increasing prevalence of depression, anxiety, and other mental health problems. As well, it's been an accelerator for innovation and implementation of digital mental health tools. If we think about, the great expansion of and use of virtual care, I mean, that's one of the primary examples. So, when embarking on a digital innovation strategy at CAMH, we decided that it was really critical that we engage patients and families in informing the strategy. So this project is part of that understanding. Well, from a Canadian perspective, consulting Canadians in terms of what their needs are for digital mental health, so that we align our initiatives to their needs rather than well-intentioned assumptions of the healthcare community. As such, the objectives of the study is to explore the digital mental health priority areas of Canadians affected by mental health conditions. So those who are seeking care but have yet to do so, seeking mental health care but yet to receive care, those currently receiving care, so patients, and then care partners. So methods. As I mentioned earlier, this is a pan-Canadian survey, which was conducted earlier this year in February by a research data collection company. So I think that's one of the limitations of this work too. I'd just like to point out from the outset. This work was administered to a web panel of Canadians who receive, I guess, points for various point systems like groceries and get gas and things like that for their participation. So we used a proportional quota sampling strategy based on age, regions in Canada, and gender to get somewhat of a representative sample, a sample somewhat representative of the population in Canada. Inclusion criteria for this work included those who were 18 and above, identified as a Canadian resident, and then 3 can read English or French. Survey was, as I just mentioned, survey was deployed in both English and French, and consisted of multiple sections. So this poster is only covering one of them, but other sections included experiences with internet and technologies, digital mental health tool utilization, thoughts on privacy and trust as well, and as presented here, priorities for those with mental health problems. So we provided participants, for this question, we provided participants with a list of different digital mental health initiatives that were thought of by the group, and provided them with plain language explanations, short sentence about what each one is. So the question itself is, from your perspective, which of the following are most important to improving support for Canadians with mental health problems? So they were asked to select 5 and rank them. Rank the top 5. So the first option was curation tools. So tools that help them best decide what digital mental health tools are best suited for them. A second is library, so a centralized hub to access digital mental health tools. Third is artificial intelligence or machine learning, so use of data to predict and understand health. Fourth is a chatbot, a text-based conversation with software about their care or healthcare. Excuse me. Interactive voice response, so voice-activated conversation with software, again, similar to what a chatbot does, but with voices. Virtual care, accessing mental health care through video conferencing. Integrated care, so the use of digital mental health tools in the care journey in conjunction with the treatments and program of the healthcare team. Collaboration tools. So these are tools that enable collaborations between organizations. This includes academic institutions, care institutions, and even vendors to develop best evidence-based tools. Social media. So mental health specific social media tool to securely connect people with lived experience. Mental health passport. So provide people with access control of their personal health information throughout their care so that they can bring it with them throughout their care journey. Consent management, so access control of their personal health information for research. Navigation, so tools that help individuals navigate through the mental health care system and how to access care. And lastly, secure messaging, so text message or secure email access to healthcare providers. So based on the rankings, we took the scores and weighted them to create weighted average rankings for each priority, and then did it for overall results and for 3 subgroups, and that's what we'll be presenting here. So results. So overall, our population are identified as Canadians who self-identify as Canadians affected by mental health conditions. So there's 1,003 participants in this with a response rate of 26%. There was a question in the reviewer comments that suggested we answer it here. Why do you think it was 26%, considering it was delivered to a web panel? I think 26% is a pretty standard number for survey response. I think maybe part of the reason why it's only 26% is that they're being provided with many different surveys. So this might not have been a priority survey for them, and some just chose not to do this. So that's something to keep in mind when interpreting these results. So the Canadians affected by mental health conditions broke up into 3 different groups, as I mentioned earlier. The biggest group in this sample is seekers, so those that felt the need to seek care but have yet to do so. Patients, those who are currently receiving care and or have completed a mental health treatment. So this is made up of a quarter of the sample, and then care partners. So those are family members, significant others, friends, or supporters of persons with mental health conditions, and this made up about 1/3 of the sample. Before we delve into the priorities, we kind of put together these, just provide a profile so that you can really start thinking about the who is answering these questions, whose priorities are these. So overall, some things to note. There's less youth, so in the whole sample, over about 3/4 are 35 and above, age 35 and above. Income was pretty much evenly distributed across the sample. A large majority of this sample identified as white, with almost 3/4 doing so. About 51% of this, so half, were still relatively new to mental health or newly affected by mental health, so with a little less experience. And about 70% routinely use digital mental health tools. For seekers, some things to note. Uh, so this was a younger group, so over 72% were less than 54 years old. Um, and made a little less money. Seekers were a little more diverse in terms of race and ethnicity, uh, and a little less experience as well, with 71%. And then a little less routine use of digital mental health tools. In terms of patient, there are more females in this group. There are more in the middle age bracket. Um, More than half made more than $80,000 household income. Um, Almost 80% identified as being white, and 40% were more experienced with 5+ years of being affected, and about 80% also routinely used digital mental health tools. In terms of care partners, these tend to be older individuals who made more money. Also, high percentage of those identifying as white and more experienced with 5+ years affected by mental health conditions and having a caring for someone. And then also higher routine use of digital mental health tools. So here are the priorities. So as you can see, digital mental health curation tools and navigation tools were in the top two positions for all the groups. Um, and and then afterwards, we have secure messaging, mental health passport. Those two were included in all three groups in the top five. In terms of integrated care, it was in the top five overall, but then was less important to those seeking care and was rated 6 for patients and care partners. Collaboration tools are seen as more important for carers and seekers than patients. Um, and patients valued the digital health library, so being able to access tools at a centralized hub as more important than the other groups. And then virtual care was surprisingly ranked much lower than we expected, falling outside top five for everybody. If you look at the bottom two, ranked 9th and 10th, social media and artificial intelligence, those you can notice there's a bit of a drop off in terms of the weighting. So the scores are much lower, and they're not integrated with the other ones, indicating that there is a bit of separation and tiers of different priorities for these groups. In the third tier, which is as you see is not integrated with social media and artificial intelligence, are the interactive voice response and chatbots, and also consent management for research. Yeah, those three came last and weren't in the top 10 for anybody. So that's an overall view of what the priorities are. We'll move to the discussion and talk about what these findings mean. So despite variations in priority across the three groups, participants value tools to help them navigate the physical and digital mental health spaces. So other part of our survey, we asked about, why people prefer not to use digital mental health tools. And one of the barriers that came up was awareness. Awareness of tools available for them, which may explain why curation of tools is ranked so high. And through our other engagements with patients and families across CAMH, we also found that navigation was an issue and that people had trouble navigating and accessing care, and could be a reason why navigation tools was also ranked as one of the top ones across the groups. In terms of tools that are integrated into care, that was still secure messaging, mental health passport, and the third one was tools that were integrated into a care pathway. These maybe because they seem very deliberate and they have a very strong use case and a value proposition to them. In one of the works we cited here by Rauschenberg et al., they've in the rapid meta review they found that tools that were integrated into the care pathways more likely seem to be valuable and useful and actually used. So that's something to take in consideration when developing these tools, whether it has any relevance to them, to those that are going to be using it. Second point, virtual care is not highly ranked, and virtual interaction tools such as chatbot and interactive voice response were not a top 10 priority. So one explanation for this, it also came from the rest of the survey, which, unfortunately we couldn't present here, but, happy to have more of a conversation about it, was this idea of, one, digital mental health tools replacing standard care, face-to-face care, and two, this idea of losing human touch. And I think that could be a reason for this, given that now that in COVID, virtual care has replaced standard face-to-face care, while here in Ontario, due to restrictions, there might be a fear of that. I think also, this may also not be highly as integrated into their care as the other ones. So maybe having a clear value proposition and very reassurance that this is an adjunct to their traditional care, not a replacement, I think would be critical in rolling out these tools. In terms of limitations for this work, definitely I've been highlighting them throughout this presentation. Definitely there are limitations to the sample and generalizability, especially since it's a web panel. And the data collection methodology also is something to consider. However, these findings are really more exploratory and really intended to present preliminary insights on what priorities might be. Our future work includes further statistical analysis to really understand what the nuances are to each of these priorities. So how do things map out in terms of various demographics? And two, we'll be doing more patient and family engagement to add more depth of understanding to these priorities, and also engage those that may not be represented in the survey to hear, those that are not as often heard. So that's it for this poster. Again, happy to answer any questions. Just feel free to email me at nelson.shen@mh.ca. Thanks for your time.